Outreach and Enrollment Specialist for the Family Health Clinic. For our 25th anniversary, we're interviewing staff and community members to explore what the Family Health Clinic means to them. In this video, we are interviewing Jim Layman, our Executive Director. Jim, why don't you introduce yourself?
Okay, thank you, Antoinette. Good morning. Jim Layman. I have been the Executive Director of the Family Health Clinics since July of 2009. We had become a federally qualified health center earlier that year. And so I had the privilege of being the first executive director in the organization's history, and I still continue to be. So 11 years has flown by quickly, Antoinette. It's been a great ride, but lots of challenges, but lots of growth, and I think we've done a great job of serving our communities.
Yes. How have you seen the Family Health Clinic grow in the community since you first started 11 years ago?
Well, you know, back then there were two clinics. There was one, the Family Health Clinic in Delphi, and the Family Health Clinic in Monon. Since then, I think we have rapidly grown to where today we have 4 sites. The interesting part of that is that Burlington and Wolcott are 2 small communities that actually approached us and asked if we would be interested in placing a clinic in their small communities. Like many towns, you know, years ago, there were doctors in a lot of small towns, and that just isn't happening in today's world. So they'd had retired physicians and people who had moved on, but they were still looking for a local healthcare provider. So the growth of not only the number of sites, but the growth within our sites has been, we've had double-digit growth for 11 consecutive years. So, you know, we started out 11 years ago. I had 13 employees that worked for the Family Health Clinics, and today we have 75. We've also seen a huge rise in our number of patients and our number of patient visits. In the past year, we saw over 25,000 patient visits. So, again, it's been a fun trajectory, and I think that the future is just as bright as the past few years.
Yes, I agree. What are some ways you have seen the Family Health Clinic impact our community?
Well, I think, first of all, we provide very high quality primary healthcare services. You know, we started out basically a medical clinic. Another thing that we have added to our line of services, though, is behavioral health. So we have introduced therapists presence at all 4 sites. And we've introduced a medication assistance treatment program for addictions. We have navigators and outreach and enrollment staff, you and Barb, who help people sign up for insurance, and also help just them find their basic needs in terms of food banks and housing assistance and energy and utility assistance. So it's more than just a medical clinic. I think a very broad array of services for folks in the community. You know, I also am proud of the fact that we are culturally competent, if you will, by having translation and services available to folks who may not have English as their primary language. So quite a few things on the table.
Yes, that is for sure. What does being part of the Family Health Clinic mean to you?
Well, I took this position. I had worked at Purdue for several years in 2 other jobs, but I lived in Delphi for 25 years. And I got to actually see the Family Health Clinic begin. So I knew the folks that worked here. I was definitely vested in the community. I knew a lot of people. And so when the opportunity came up, I jumped at it because I thought it was an opportunity to grow a really good opportunity into something even bigger. Partner with school nursing, and you know, I want to give credit to Jo Brooks. She was the former department head of the School of Nursing back in the 1990s, and she worked with the community of Delphi to establish the Family Health Clinic. Carroll County has no hospital. So the nearest hospitals were in Lafayette and Monticello and Logansport. And I think that it was determined that a lot of people went to the emergency room because they didn't have a primary care provider. So I think her vision of having affordable and accessible healthcare in Delphi, Indiana, it grew into something much bigger than just a little clinic that opened up on the courthouse square.
Yes, that's indeed true. What is one thing you would want the community to know about the Family Health Clinic?
Well, I think there's a lot of things I'd like the community to know, and I think we do a good job of trying to get our message out. But I guess the one thing is that I want folks to understand that anybody can come to the Family Health Clinic. We are not exclusive to any particular insurance company or population. We're open to all. We are a community health center, and I think that's been something that we've had to overcome a little bit in over the years, is that folks thought, well, if I have insurance, I can't go to the Family Health Clinic. They don't take my insurance, things of that nature. Although we do serve uninsured patients, and that's one of our main goals, we have agreements with many commercial insurance companies, all the Medicaid and Medicare certifications. And so I just think if there's a takeaway from this conversation, is that we're happy to serve anybody in our communities, regardless of their ability to pay, and that we do provide high quality healthcare, primary care and behavioral health care.
Yes. Well, thank you so much, Jim Layman, for your time and your involvement with the Family Health Clinic.
Thank you, Antoinette. I appreciate the time.